Sorry guys, the video ended. I'm sure it's network problem. Sorry about that. So we'll just wait for Beth to join us. Yes, Beth, you're welcome back. I'm so sorry. I think it's the internet service. The connection is really bad. Yeah, so for those who have just joined us, we're just talking about the physical and psychological effects of cancer. So this phase is talking about what you go through after you've been diagnosed and undergone treatment and what have you. And everyone, goes through this thing. It depends on the cancer you have and, how well your body is able to cope with it. So, I'm so sorry that the
Oh,
internet went off.
that's fine, that's fine. Yeah, so I didn't really get to go out much, but when I did, I did have that feeling of everyone's staring at me, everyone's going to know that I'm wearing a wig. I also really worried about seeing my friends because obviously I'd changed a lot. And that's something that actually, like, I still worry about sometimes. I worry about um what they think of kind of my weight gain, what they think of me as a person, because I'm not the same person that I was before cancer. It definitely changes you, and so yeah, that's something that I'm still kind of like going through myself. And with regards to confidence, like I'm definitely getting there, but it's still something that I very much need to work on, like body image, and obviously like with the hair thing. Some people can just embrace it, and I take my hat off to them, but for some reason I just couldn't. I just couldn't. But yeah, it's something that it takes time. Um, I was really lucky. I had counselling through Macmillan, and that really helped me. Um, just to have somebody once a week that I could kind of just talk to about everything, because I didn't really have time to process anything when it was happening. So it's kind of like after everything happens, you sit back and you think like, oh God, that actually happened. Um, so yeah, confidence wise, I think, every woman struggles with self-confidence at some point in their life, don't they? And body image, I think cancer just makes it that little bit more extreme
Yeah.
and out of your control, the changes.
It's bad enough in the society you have to look a certain way, you have to dress a certain way, you have to
Yeah.
do certain things with your body that is appealing to the society. So when you get to that point where an uncontrollable event like cancer happens, it just takes a toll on you, and you're sitting there thinking, oh wow, how can I handle this? How can I do this? How can I remove myself from this situation and look the way, and this is one thing I try to like talk to people about. You don't have to, try to impress people with how you look. If you're confident with yourself, that's good enough. All you need to
Mm.
do is just wear that confidence and stop. But having cancer, it takes everything away. It just changes the whole game, So you have to be able to surround yourself around people who would tell you, what, you look beautiful regardless. People who
Yeah,
would make
exactly.
you
And I think
feel.
just being honest with people about how you're feeling,
Mhm.
and um yeah, just being open and honest. And I think talking to people about how you feel, you know, there's also a definite like loss of identity.
Mhm.
And it's not just the physical things like your hair and your eyebrows that cancer takes. It takes things that are very deeply ingrained in you, like your dignity. Do you know what I
Yeah.
mean? Things like that. And it's getting things like that, your independence, your dignity, your pride. In some cases, like you can feel extremely like hopeless, and it's not just the physical things that it takes, it's some really deeply ingrained things too.
This is why it's really important when you're facing this, you just surround yourself with people who just love you, people who
Yeah.
would encourage you. You know,
Yeah,
because a lot of
exactly.
people would talk to you about how, you know, oh, when I had cancer, the people I thought would be in my life, the people I thought would be there for me weren't. So it's just important to be able to identify, you know, people that would, like I said, would tell you, you know what, you look great regardless. It's still
Yeah.
you. We know you and we love you for you. This is just a passing phase, and you will overcome it. You know, it's not something that you would deal with for the rest of your life, hopefully. You know, so just make yourself at peace with the situation at hand. You know,
Mm.
that's something. That's something.
Yeah,
Were you
definitely.
at any point where you did you feel any kind of depression?
Yeah, definitely, definitely. There was a point, I think it was the second time that my bowel paralyzed, and I was treated in the hospital where I work. So there's even more of a reason why I used to have my head covered all the time. And I laid in a hospital bed and with nothing on my head, and I didn't speak to anyone for about 8 hours. I just laid there facing the wall, and I'd just given up. And I just thought I just wanted to die at that point. Like I'd completely given up. Um, and I think that like my family and my friends could see that. Um, so yeah, definitely like you go to the darkest places in your mind at points through treatment. But you can pull yourself back from it. You know, that's the important thing you have to remember, is that you can pull yourself back. And like you say, your support network is absolutely vital to that. And obviously, if you feel like you can't manage, you can go and speak to your doctor, and there's, you know, antidepressants or, you know, counselling and different kinds of therapies. So I'm waiting on the waiting list to be seen by a pain psychologist as well. You know, there's lots of different people out there that can kind of help you
Mm-hmm.
mentally to cope with physical and the emotional things.
Well, that's another thing. That's another killer. Depression. That's something
Mm.
that I feel society should really, you know, put a lot of emphasis on. Most of this is like speaking on like a normal ground, not even when you have cancer. When you feel someone is depressed or when you see someone going through depression, I feel like it's something that you should really, you know, um, we should really focus on, you know,
Yeah,
talk to the person and just engage that person in a conversation, you know, or something, regardless of how. Just make the person feel willing to talk to you, because depression is a very, very dangerous thing. It's a
yeah,
very dangerous thing that people suffer. And I see a lot of organizations, you know, reaching out to people. You know, if you're depressed, you can call and talk to someone. There's a lot of helplines that, you know, talk
yeah,
to people who suffer depression, because it weighs you down mentally. And if you're not surrounded with the right people, it will get to you.
mm,
It's something that
yeah.
you really have to sit down and if you feel a certain way, just talk to someone.
Yeah, you need to almost try and kind of nip it in the bud, do you know, as much as you can. Like, so
Yeah.
try and catch it early, sort of thing, isn't
Exactly.
it? It's then it's yeah, yeah,
That's
definitely. So
that's that's so it's a very serious thing that people really, really need to like take into consideration when talking to people.
mm, definitely,
At, at,
definitely.
at any point, like during the treatment, did you ever feel like I'm undergoing this treatment, it could reoccur?
Yeah, all the time. So I think it's just a thing, like when you get diagnosed with cancer, after that, every pain, every lump, every bump, do you know, in your head, that's your cancer back. And um I think for me, because and this seems to be like quite a common story with lymphoma,
Hmm.
people are misdiagnosed for so long. So I had so many blood tests, but I was told that my bloods would be more deranged if it was anything serious. I had ECGs and it didn't show the fluid on my heart. I
Wow.
had, do you know, like so many tests, and it wasn't picked up. So now I find it really difficult to find any comfort from that, any reassurance. Does that make sense? So like,
Yeah.
if I
I,
phone
I,
my,
I get what you mean. I get what you mean. Yeah.
yeah, if I phone my hematologist up and say, you know, I've got a lump here or whatever, and she says, oh, but your bloods are fine. In my mind, I'm not satisfied unless I've had an X-ray and all of this, you know,
Hmm.
because of it took 5 years for me to get diagnosed, and that's a really, really common thing with
Wow.
lymphoma.
Wow. That's something. That is something. Really. Oh, someone has asked that how were you able to curb worry? Like, how did you deal with worrying with cancer?
Oh, it's a difficult one. I think I just try and reason with myself in my own mind, you know, and kind of tell myself, you know, that it's unlikely that it would be that. But if I am worried, then I will contact my medical team, and um, they will, you know, test my bloods and have a look at me, and reassure me. I think, you know, if you are really concerned, don't not get it checked because you think you're just worrying. Like, go and get it checked. There's nothing wrong with that. And I think that medical professionals will expect you to be
Yeah.
anxious,
Yeah.
you know, and that's okay, and that's completely normal. Because wouldn't it be terrible, you know, if you'd had cancer, and because you'd had cancer, you always had that anxiety, and because you always had that anxiety, you didn't get something checked, and then it was cancer again. That would be awful, wouldn't it? You know,
Yeah.
so I think if you're worried, there's no harm in just when you're giving them a call and just saying, you know, look, I know it's unlikely, but I've got this niggle.
Wow. Wow. During the phase of your treatment and everything, when you had people around you, did you at any
Mhm.
point feel like guilty for letting them, leave everything they're doing, just come and dedicate hours and hours with you? Because a lot of people feel like they feel so much guilt just from having the family members leave everything they're doing, and they express it in a way that the doctors and the family members are like, don't feel that way. We love you. We're here for
Yeah.
you. Whatever you're going through, we'll be there through the end. Did you ever feel that way, like at any
Yeah,
point
so
in time?
nobody ever like made me feel that way, but I think it's like you say, it's in your mind.
Hmm.
Yeah, there was times where, and even now, like where you feel like a burden. Do you
Hmm.
know? You feel that. And I remember times when I was in hospital, my best friend, who's on here somewhere, she would come and see me, and they'd be like, right, we're going to get the ITU team just to come and see you, just to check. And she could tell that I'd be terrified.
Oh.
And she would be like, do you want me to stay? And I'd be like, no, no, go home. Because I knew that she was working and, you know, looking after her little boy. And I didn't want to be that worry. But she would sleep in the chair next to me.
Oh,
She's so nice.
is that
Um,
Amy? Is it Amy?
yeah,
Oh
yeah,
my
that's
God, I've
Amy.
been seeing the comments.
So she'd
Oh,
sleep in the chair
she's
next to my
amazing.
hospital bed because I was scared. And,
Oh,
you know, I never would have asked her to do that because I wouldn't want to be that burden, but she would do it. And I think it's having people like that around you
oh,
who know
that's
you well enough to be like, right, no, she needs me or whatever.
it. She has been commenting, and I'm like, this has to be your girl. She has to be your girl. Oh, that is
Yeah,
so lovely.
she is.
It's
She's the one who used
amazing.
to put my hair in her bra as well.
She's such a babe. She is such
Yeah,
a
yeah.
babe. It's beautiful to have friends, that would take care of you like that. People that
Yeah.
would your worry, before every other thing at that particular time.
Mm.
It's something. It's something. So obviously
Yeah, and
you
it's
never
people doing
felt
it without
lonely.
you having to ask as well, because
Hmm.
sometimes you don't want to ask, do you know, because there's so many things that you need. Do you know, you can't ask for them all. You feel like you can't ask for them all. So
Yeah.
having someone that will be like, just does it is amazing.
Hmm. Oh, that's beautiful. That's beautiful. She's something.
Yeah,
That's
she's a
very nice.
star.
So you obviously at that point you never feel that's the whole idea is for you to not feel lonely at any point in
Mm.
time. You understand? So that's actually very good because a lot of people really don't have the luxury of sharing that kind of bond with people. So it could be very difficult for them to have like a shoulder to cry on, at that
Mm.
time.
Yeah,
So
I can't imagine how I would have got through it
mhm.
without my my brother saying, "Mum never left your side either."
Oh.
It's true. I don't know how I would have coped without my support network. I really don't, and I can't imagine having to go through that without that. You
Yeah.
know, yeah, must be so so tough.
Wow. Wow. This is something, honestly. This is so what about your other friends and other family? What's your relationship like with them? Your other
So,
friends.
my work colleagues have been absolutely brilliant. They have been really supportive. They come and visit me. I've got other friends that are, really supportive, visiting me, just, checking up on me, making sure I'm okay. But then you do get friends that ghost you. Um, they won't talk to you and I think it's because they don't know what to say. I don't think that it's a hurtful thing. I think it's just that they don't know what to say and they can't kind of make sense of the situation of what's happening to you.
You.
But rather than thinking about you, they're thinking about how it's affecting them. Does that make sense?
Wow.
And they kind of, so, if they see you, they try not to have a conversation with you because they don't know what to say to you. So that happens. But, I think sometimes you just have to kind of move on and you learn who your like true friends are. Do you know, like
Friends
that you can
are that
100%
that's
rely on, like,
that,
and that's precious. So
wow. That's no in a way, speaking from a humane point of view, that is crushing. Most especially if you've had friends for a long time and then they know you have cancer and they just avoid you. See, this is the stigmatization that I try to talk about. as
yeah,
much as much as you might want to look at it from a positive point of view, it is one of those things that we really talk about so that people understand that if someone has cancer, it doesn't necessarily mean they're dying. Yes, it is a
no,
thing that if it's not treated could lead to, but when they're
mm,
undergoing treatment and they're in good hands, you know that they need this love and support no matter how little.
yeah,
It's not a death sentence. Do you
no.
understand?
And I think sometimes it's about people putting, being able to put kind of their feelings aside
Hmm.
to look after that person, to be there for that person that needs them, that friend that needs them. Like, yeah, it might upset me if I saw one of my friends who had cancer, but I wouldn't let that stand in the way of
Hmm.
me helping them.
Of course, of
So
course.
I'd put that to one side and be there for my friend. And I think, it is the stigma, like we said, the hair loss, cancer, dying. There's the stigma, isn't there?
That's this is the point I'm trying to make. It's not a death sentence. At that point in time, the person who has it is already thinking the worst of themselves. So the least you could do is make them feel at ease with that situation at that time.
Yeah, yeah, and you're
I
you're
don't
still
think
the same person, like you are
I,
still the same person,
exactly
and
whether you have your
you
hair
haven't all of a sudden
or not,
changed overnight because you've got a diagnosis.
whether you have your hair or not, whether you have your
Hmm.
eyebrows or not, the condition, like this is the same thing I said the other day. It could affect anybody. It could happen to anybody. See, this is why
Yeah,
we raise awareness and make people understand it is a situation that could occur to anybody at any point in time. So you avoiding someone because the person has cancer or the person looks different from the way you used to know the person is not rational. It doesn't
No,
make
no.
any sense to me.
Yeah, and it's like one in two of us are going to have cancer in our lifetime. So every single person's going to be affected by it in one way or another.
One way or
Whether
another.
it's you or someone that you know
There's a
it's
lot of
gonna affect
predisposing
you.
factors that could lead to it.
Mhm.
Regardless of what you do or who you are, you never know.
No, no,
So
exactly.
when you see someone you're familiar with, an acquaintance or a friend, it is important to make them feel at ease with the situation.
Yeah, yeah, I think so too. And try and support them the best that you can.
That you can. Do you understand?
Yeah,
I'm so sorry. I've been turning this thing around. I'm
no,
just
you're
trying to get the sun away from my face.
you're fine. You're fine.
It's no, no, no. This is why shows like this are important. So they make people understand that it's just a phase that someone is going through. It might not
Yeah,
be the best. It might not be the best suited for them, or anyone. But it's an illness that could affect anybody.
yeah, yeah. And the other thing with friends is obviously when you're told you're in remission as well. So you finish treatment, everyone thinks that you're better all of a sudden, but you're not. Do you know? You don't feel any better. Well, I personally didn't anyway. But your support network kind of shrinks a bit, and I think for me that's been exacerbated by COVID because a lot of my friends work in hospitals,
Mm-hmm.
so I can't see them because the
See them
risk's too
exactly.
high. Um, but yeah, so that's the other thing as well. Like just because someone's got the all clear, that's when the psychological side of it really kicks in, and you
Mm-hmm.
start to reflect and think about what's happened, because before that it's all been happening around them, and then once you get that you're in remission, off you go. That's when you stop and think, and that's when you need your friends around you to support you, because your medical team aren't there anymore.
Mm-hmm.
Well, they are, but they're not in the same sense that they were before.
Yeah. Yeah. Oh wow. So with work and everything going on, I know obviously you miss work.
Hmm.
You might miss work maybe 70% and 30% you're like, but I'm so happy I'm not even there right now. I can imagine. But how have you been able to deal with not being able to go to work and like do like the normal routine and everything that you've been doing?
Yeah, so like you said, I do really miss work. I miss that feeling of kind of having a purpose. And I miss that feeling of kind of waking up in the morning and feeling like almost like there's a reason to get up, do you know?
Mm-hmm.
Um, so I am going to start working from home
Okay.
soon. Yeah, just doing like I think 9 hours a week, just so like really, really gradually, because of my nerve as well. Obviously that's flared up at the moment, so I'm going to struggle to sit at a computer for any long period of time. But my work has been so good, really understanding. So I'm going to have a really phased return.
Mm-hmm.
Um, and they're not expecting me back in the hospital, I don't think, until February, which is when my immune system should have recovered fully.
Yes. Yes.
But I have really, really missed work. I've missed feeling like part of a team. And I've just really, really missed it. And I think, give me 12-hour shifts, and I'll probably be moaning about having to work the
Yeah,
weekend.
I know. I can imagine.
Yeah. But yeah, at the moment, I really miss it.
Oh,
Yeah,
it's
but it's
it's
finding other things to do, things like this, finding other things to focus on. Because you do need something, like you can't have your days can't just be filled with nothing, you know. So, for example, like I'm doing a charity walk for the Anthony Nolan Trust, which is a blood charity foundation.
mm-hmm.
and they do bone marrow transplants and things.
Oh wow.
So I'm doing that to raise money for them, you know, which is something that motivates me to be active,
Hmm.
and it's something to do with my time. So it's finding things like that, or things that you enjoy doing. So I used to do like some painting, I sell skincare products, do you know, like things like that. Just finding things that you enjoy that you can fill your time with when you're not working, because you need something.
Yeah, that's good. That's actually really good. That's actually really good.
Mm.
It's good not just for your physical being, but for your mental state of mind as well. You know,
Yeah,
reading
exactly.
books and all of that would help you mentally, emotionally. You know, you get your mind off so many things and
Hmm.
just dwell on the positive mostly,
Yeah,
which is
exactly. And
very
try and
important.
stimulate yourself. You need stimulation, you know? And then hopefully then that will mean you'll sleep better, which will mean you'll have less pain, which will mean that, do you know,
Exactly.
like everything's got like a
It
knock-on
just
effect,
connects
hasn't it?
one way or another. There's just an
Yeah,
interconnection with everything, which makes it so beautiful. You know,
yeah, yeah.
I'm so happy. You know, you've reached this point where you're able to do all of this and you know feel better, because
Mm.
that's the most important thing, to be honest. You know, you being able to get yourself and understand your body better, you know, and all of that. But I'm actually really sorry, you know, about your friends who have abandoned you in your time of.
Oh, do you know, it was very few, to be honest with you, like not many. But I think, like I said, I don't think it's vicious. I don't think that there's anything malicious in it. I think it is just they don't know what to say. And I think that educating people about cancer and young cancers, and you know, it's not catching, do you know, like it's like you say, it's not a death sentence, like, and that person is still the same person, and the only way you're going to do that is by educating people and raising awareness. So maybe those people that react like that just need a little bit more understanding of the situation.
Oh, wow.
So
So this for everyone who's been watching, Amy, thank you so much for having
yeah,
us.
thank you, Amy.
Ify, Bio, all of you, thank you so much. So this is just an insight, you know, on what you'd expect someone who has undergone um, cancer treatment, you know, and this effect, and you know, but physically, socially, emotionally, this is what you'd expect them to go through. You know, these are the most common side effects you would see. So today's section was just to raise awareness, to educate people on what exactly, you know, people go through. They might put on a smile on their face, you know, they might tell you, oh, it's okay, I'm better. But you have to understand that there is so much more to that, you know, than what you just hear and what you just see. So you always, we should try to always make them feel at ease with their situation, you know, regardless of how happy they appear, or how, you know, how they try to shrug it off and all of that. These side effects are something that you won't really think of. You know, you will
Yeah,
never sit
cancer
down.
affects more things than you could imagine, you know. It's like I never expected half of the side effects I had. I thought I might be sick,
You
do you
could
know?
you could exactly, you could just sit there and everyone is talking, and you know everyone is happy responding, but they never would really understand that maybe in your mind you feel guilty, you know, that they're there, you're
Mm.
not necessarily asking, but just the fact that they're offering, you feel like it's too much, but they don't feel that way. Do you understand? So we should try, you know, to always um make people with cancer feel, you know what, it's not just you, it's all
No,
of us,
and it's
we're all
okay.
in this together.
Yeah, and it's okay not to be okay, and it's okay to ask for help. Do
Exactly,
you know? Like,
exactly. It's okay to ask for help too. You know, if you feel you
yeah,
cannot do it by yourself, there is nothing wrong in telling your
no,
mom,
no.
your brother, and thanks to your mom too. You know,
Mm.
they already make so much sacrifices as it is, as mothers.
Yeah.
Now being able to like just sitting there and watching her own child go through so much pain, she only knows how like that feels for her, which people you might not know. She might not necessarily tell you. Do you
Yeah,
understand?
exactly.
But she knows
Exactly.
like how hard it was for her, to watch her baby go through that. So, you know, thank you so much to your mom as well, for being amazing. And your brother. And your
Yeah. Yeah.
brother. It's so beautiful to have people who are always there for you and all
Yeah,
of that.
it's so
So,
important.
mhm,
Yeah, really, really important.
mhm.
Definitely.
So anyone who has questions or you have anything to say to Beth, you can follow her on Instagram at shit_sandwich19. And if you have any questions or any contributions to make to with regards to cancer, if there's anything that we haven't really you feel we haven't really emphasized on today, you can send an email to either of us, and when we do our next session, which we hope to do very soon, we would
Yeah,
definitely
yeah.
address it.
Yeah,
Even
or any ideas of topics that you want covered for the next sessions. Um, yeah, and we can try and kind of tailor it to what people want
once
to know
exactly.
rather than listening to me just waffle on.
No, but if you when you talk, they get to understand it. Like I said to you
Yeah,
the other
yeah,
day, like when I'm talking, it's just like, okay, she just saying things based on she knows this from medical blah blah blah, but when we have this kind of conversation, it makes them understand from your perspective, from your point of view, because how
yeah.
you feel is different from what I understand. Do you understand
Yes,
what I
yeah,
mean? So
yeah,
it's
yeah. And I think that is evident and like I said last time, for me, going back to work, I will have a very different approach to my patients now
now.
that I have been through this experience than I was before, because of the insight I've got, and it will be very different, very,
Yeah,
very
it will.
different. Yeah,
There's one thing
yeah,
to see them go through it and just be like, oh yeah, and then there's another thing to see them and think, oh yeah, I used to have this. I know what you're going through. I know how it feels. So it's
yeah,
just, yeah, and I'm actually looking forward to raising more awareness, with this thing, so people understand why it's important, to take various approaches towards cancer, most especially.
yeah,
It's considering there's you've had Hodgkin's lymphoma, there's breast cancer, and even though there's treatments now to manage and treat people, there's other forms of cancer that have no treatment per se. They could go
mm.
through a lot of what's it called? There's a lot of experimental drugs out there,
Trials.
exactly, trial medications for people
Yeah,
that don't, and there's still increasing, understanding with regards to cancer treatment in general, so it's important for us to raise these awareness for people to understand that, like I said, cancer is not a death sentence. You
no,
have
no, and
so
anyone, cancer doesn't discriminate either. Anyone can have it. Just because you're young doesn't mean you can't have cancer.
exactly.
Just because you're a man doesn't mean you can't have breast cancer. Like, it doesn't discriminate, it's everybody, and it applies to everybody. And yeah, it's just general awareness. And you know cases of lymphoma in young people is on the rise,
Hmm.
um which is a cancer that I think there's very little awareness of.
Exactly.
um I didn't know much about it. It took 5 years for me to get diagnosed. So I think that, you know, it, there's so much kind of awareness around so many things that need to be raised, isn't there? And it's the understanding of the chemo, understanding of the side effects, which we've kind of like touched on today, but the list goes on and on and on, doesn't it? And
Yeah.
we could probably sit here for days discussing the side effects.
I
Like,
just hope, we're able to reach an audience where, you know, people also see the importance of handling like cancer patients and the importance of making cancer a priority, you know,
mm,
in the health sector. You know,
yeah,
just
definitely.
yeah, that's the aim. That's the idea behind all of this. Let them understand that,
Hmm.
you know, I know, like, for example, in Nigeria we have malaria, which is like our top killer. You
Mm.
know, being Nigeria is in a tropical, you know, environment. So I feel like cancer, you know, should also be put on that landmark where people are
Mm.
thinking, okay, if you have cancer, you know, don't just think, oh yeah, that's the end. Don't, no. It should be something that
Yeah,
we sit down and they're like, okay, we can deliberate on the cancer treatment that would be suitable for you, and all of that, and then work towards
yeah,
that.
there's hope, isn't there? That's the thing. It's not that there is hope. Like, definitely. Someone's just said, I think it was Amy, can we do it on Facebook next time and
Facebook.
then people be able to share it? We could do, couldn't we?
Yeah, yeah, we can do that.
Yeah,
That's
we can do that.
um
Might
you
be,
can
we could
send
maybe
me
do
your
it on both. I
yeah,
don't know
you
if
can
you can.
send me your
Yeah,
username, your name on
hmm,
Facebook. I could add you up, and then we
yeah,
just
we
do
do that.
this. I feel like it will reach a lot more people, like she just said. Yeah. Mm-hmm.
Yeah, we'll do that then. Next time we'll do Facebook.
All right. Oh, thank you, Amy. Oh my goodness, this is great. This is amazing. Thank you, everyone. Thank you
Yeah, thank
so much for
you.
joining us today. And Beth, thank you so much. You know,
Oh
like
no,
I
thank you
said,
for having me.
if you feel like talking anytime, if you feel like just, even if it's just a video call or something, to talk to someone or whatever, just I'm always here.
Oh, thank you. And likewise to you. Likewise to you. And we'll work out what we're gonna do next time on Facebook then. And
Okay.
then we can yeah, go from there and make a new one.
Ify, thank you so much again. Oh my god, that's my friend. She waits for these things, and every time she
Um,
sends me like thumbs up, like "Yay, go girl!" Thank you so much for logging in. Yeah, so we'll definitely do the Facebook one, you know, so we're
yeah,
able to reach more people as well. That would
perfect.
be lovely. All right, thank you guys so much, and have a lovely, lovely evening. Bye.
Bye, thank you.
Thank you.